Why now? It's really the million-dollar question. It's kind of a convergence of all these factors, but mostly that new technology is enabling greater and easier access, and that younger generations prioritize convenience and service and are really placing a limited value on personal relationships.
Hey gang, it's Tuesday, October 12th. Rajiv and listeners, welcome to the Behind the Numbers Daily, an eMarketer podcast made possible by a new star. I'm Marcus. Today I'm joined by one of our digital health analysts. It's Rajiv Leventhal.
Hey Marcus, great to be here again. Thanks for having me.
Hey chap, thanks for hanging out again. Today's fact, before we get into the episode, saying God bless you as a response to sneezing came from the days of the plague. So I remember looking at this one years ago. It is fascinating. So thought I'd bring it to the table. It became commonplace to say God bless you after someone sneezed back in Rome when the bubonic plague was running rampant through Europe. A common symptom of the plague was sneezing. So the Pope at the time, Pope Gregory I, suggested saying God bless you to anyone who sneezed in hopes that prayer would save them from the deadly plague. What's crazy is that the plague was 700 years ago in the 1300s, and we still say it. So,
reminds me of the Seinfeld episode where they're saying, well, you feel so gross after you sneeze. Let's say something better, like you're so good looking instead of God bless you. So they ran with that for a little while.
I like that. I still haven't watched Seinfeld, and people always give me that look like, what the hell have you been doing with your life? And I get it. I need to watch it at some point. I'll watch it soon. It was already brought up earlier today in a separate conversation. It happens often, but in the spirit of talking about other things people might say, in English, we obviously say bless you or God bless you. A lot of other countries will offer, I went through a list of every country in the world and what they say when you sneeze. What a productive day. A lot of other countries will offer words of good health. The Greeks and the Romans by far have the best one. So this Romans, I guess this is kind of dated. It's not people who live in Rome now or people who live in Greece now, but back in the day, they used to say, banish the omen. Which I'm bringing back because after someone sneezes, if you just shout at them, banish the omen, you're going to at the very least freak a lot of people out.
Yeah, people are going to look at you like you have two heads and four eyes.
Anyway, today's real topic, how primary care is being disrupted. We're talking about primary care and how it's being shaken up a little bit. Rajiv, let's start by explaining what we're talking about when we're talking about primary care. Because to be shaken up, we have to talk about how it exists in its current form. So when we're talking about primary care and the primary care landscape, what do we mean?
Yeah, of course. So primary care represents the entry point for most patients' health journeys, right? You go to your primary care doctor for a variety of reasons, but not super urgent or emergent most of the time. So there is a big reason that shakeup and disruption is happening is that there is a huge market size here, right? Primary care is a $250 billion or $300 billion market. And like we see with other areas of healthcare, when you have a market that's so economically large, healthcare in general is a $4 trillion market, it invites outside entrants, non-traditional players to come in and see, okay, what's going on? How can we make our presence felt, right? And usually, disruption is a kind of a buzzy term, but when you have a market that's this economically large, and then you have consumer and physician frustration. And when you put those elements together, you're kind of have the perfect storm for disruption. So why are consumers and why are primary care doctors frustrated? Well, primary care doctors are burnt out. There's so much data showing that primary care physicians are working long hours. They're underpaid compared to their specialty physician colleagues. Primary care physicians are the lowest paid of any medical profession. And they're spending too much time, what we call pajama time, quote unquote pajama time, which means they're actually doing work, outside of their office too. A lot of administrative and bureaucratic work. So they're looking for a better work environment, and patients and consumers are looking for more convenience and easier access. We mentioned in our retail health podcast how long it takes for some patients to get a new family physician appointment. 28 days in some markets of the country, just absolutely ridiculous. So disruptors, and we'll get into them a little later, they're coming in and they're saying, well, we can offer a better work environment for primary care doctors, and we can offer a more convenient and easier to access care delivery landscape for consumers, and shorter wait times, and you don't have to drive so far to just get an appointment in a week, and more virtual care and easier technology use, things like that. And all those factors are kind of converging and leading to a landscape of disruption.
So when we're talking primary care, we're talking about going to the doctor's office, we're talking about going to these emergency or urgent care clinics. Is that the kind of the limit? Are there any other doors that people can open to get access to primary care?
Yeah. So, primary care is kind of, it's your typical family physicians, internists, really, sometimes pediatricians are counted, but, they're a little bit of a specialty. It depends on who's defining it. But urgent care provides primary care services, just often more expensive. And ER can technically provide and does provide primary care services, just more expensive. And then you have the retail health clinics again, who are really only providing primary care services right now. So that's where your typical consumer can get a primary care service done.
Right. Yes. Okay. I was going to ask whether, hospitals offer that as well, but then I hesitated because I thought, well, no, it doesn't feel like primary care because it's care that is of a more significant magnitude, but we're talking about primary. What's the primary way that you introduce yourself into care? And it could very well be a hospital, as you just explained, or the emergency room. Who is shaking up primary care, Rajiv, and how?
Yeah, so you have a bunch of different disruptors. The more innovative startups are really doing the bulk of the shakeup. So you have companies like One Medical, who might not be known to a lot of people, but One Medical is a primary care startup that's based in San Francisco, but they have offices all around the country, and they're mostly in affluent metro areas. And they're called what we call a concierge primary care company, which means they are really developed around their ease of services for their patients. Now, One Medical charges members $200 a year just to be a member before you can even have your insurance kick in for, your visits and your services. So the reason why they can do that is because they give patients around the clock access to, their digital health services. You can text doctors all the time. You can schedule same-day appointments. You're not in a waiting room for 45 minutes. So One Medical believes that we can kind of reach a group of patients who are willing to spend the money, or they sometimes reach employers like big tech companies like Google, who pay for their employees' membership, the $200 a year membership.
Right.
And then, the patient's insurance is on the hook for the rest. So, they're one example of that.
I mean, when you talk about that example, $200, when you think about how much people pay for the healthcare throughout the year, it does kind of seem like a drop in the bucket. I mean, yes, it's more than $0, but based on what they seem to be offering, it does seem to be worth it. Especially the one thing that jumped out to me across these concierge and, as you described them, tech-centric startups was this idea of access, 24/7 round-the-clock access. Doctors even giving patients their personal cell phone numbers as well, which is a fascinating example. Another one you mentioned in your report, which just dropped last week, Oak Street Health, based in Chicago. Talk to us about them.
Yeah, so Oak Street Health is one that's concentrated more or only on Medicare eligible patients. So, the senior population. They have 100 or so of these primary care centers in 15 or so states. And they're another one that their waiting rooms can more look a lot like community centers, right? They want to kind of ditch that traditional medical office archaic feel. They have a 24/7 support line, as you mentioned. They'll pick you up from your house and drop you off at the center, and then drive you back to your house when the appointment is over. They have Medicare education classes. They do some behavioral health care and social health support. Oak Street says that their physicians, they employ about 400 physicians, spend twice as much time with patients as the national average. And that's a big driver in patients continuing to come back because they don't want to wait in the waiting room for 45 minutes. They want to get in and then spend time and talk to their physicians. And, physicians want that as well. So Oak Street is another one. They're focused on that Medicare population. One Medical has, just go back to them quickly, they have, I think, 700,000 or so members, and they're not focused on Medicare population. They're more commercial population, so non-government insurance.
Okay.
So these different startups kind of cater to different populations of consumers, but they all have their own business model. And one overlapping theme, again, is just ease of services, technology centric, really just user friendly and easy to interact with them.
So really quickly, you highlight a bunch of different examples, One Medical, Oak Street Health, and others. If you had to point to one of these startups that you think is most likely to disrupt primary care on the biggest magnitude, on the biggest scale, which one would you point to and why?
One Medical is probably the biggest one in terms of how many members they had. Like I said, close to 700,000, and they're only going to continue to grow. It's an interesting question you bring up, Marcus, because there are a lot of these companies, and not all of them are going to succeed. In fact, many probably won't. I'm not even sure if any of them are profitable right now, and a lot of them are pretty new age, so it's tough to be profitable in the beginning. But time will tell, and certainly some of these will be weeded out in the coming years. And there might be ones that we don't even know about that will emerge. But One Medical is one that I think sticks out to me because of how they partner with employers. Like I mentioned, Google and some of these other big tech corporations partner with One Medical, and then they'll pay the $200 member fee for all of their employees. So I think that's a model to certainly watch out for.
Another way you say that primary care landscape is being shaken up is by these retail health clinics. We talked about those in a previous episode, CVS, Walgreens, Walmart, etc. We have numbers suggesting now a quarter of Americans are retail clinic patients. So that's another way things are being disrupted. You kind of addressed part of the why now already, but any other reasons why now? Rajiv, why is primary care being disrupted now?
Why now? It's really the $1 million question, Marcus. It's kind of a convergence of all these factors, but mostly that new technology is enabling greater and easier access, and that younger generations prioritize convenience and service and are really placing a limited value on personal relationships, which really has, kind of been the core of primary care forever, a personal relationship with your PCP, your primary care physician. But, check out a couple of these stats. 35% of millennials reported in 2019 that they don't even have a primary care physician. Okay, so more than a third don't even have one. What does that mean? That means that they're more willing to bounce around to a CVS Health for a primary care issue one time, to, they'll find a random physician on ZocDoc another time, to maybe they'll go to a virtual only telehealth primary care provider the third time. And in fact, the pandemic has, as we all know, has spearheaded such a virtual care boom that a December 2020 survey found that 50% of Gen Z consumers and 50% of Gen X consumers said that they would be okay with not even have a primary care doctor if telehealth can replace that appointment. So just much less value in that personal primary care physician relationship, and just many more options, be it one of these concierge companies or retail health or simply virtual care. I haven't gone into a primary care physician's office in like 2.5 years. I just do all of them virtually unless I have a greater need.
Well, you noted that patient visits had tanked last year because of the pandemic, but there's also, there's a growing group of kind of younger people who maybe aren't going to the primary care physician as much, but we do have numbers suggesting that about 60% of Americans are patients of primary care physicians. That number is pretty flat, ticking down slightly. You could, dig a little deeper and see how often are they going, what are they going for. Another reason why now you mentioned primary care physician burnout, physicians leaving independent practices. And then also, a shortage of PCPs, primary care physicians, a shortage of 20,000 physicians today. In 10 years, a shortage of 50,000, according to the Association of American Medical Colleges. All right, we're going to pause the conversation there for just a quick second and take a word from our sponsor, Newstar, and then we'll be right back. Are you prepared for marketing's next chapter? You won't want to miss Brave New World's 2021, the virtual marketing and analytics event of the year on November 9th and 10th. Join Brave New Worlds to learn how you can adapt to the forces redefining advertising. It's free, and you'll hear from today's top minds in marketing, data, and analytics, including executives from Facebook, General Motors, Capgemini, Publicis, and more. Go to bravenewworlds.newstar to register today. I want to ask you, so Rajiv, in your report, you note that America spends just 5 to 7% of total healthcare spending, 5 to 7% of total healthcare spending on primary care. What's going on here? And has it always been that low?
Yeah, it's been in that 5 to 7% range for a while, and it's interesting because PCPs, the primary care physicians, still deliver most of the medical visits every single year. We just spend too much on hospital care as a country, Marcus. Hospital care on its own contributes to 1/3 of the cost. So the holy grail is how to bring healthcare costs down, and the way to do that is to double down on primary care, and that's a big part of this report. It's making sure that you're combining preventative primary care on the front end with follow-up after, hospital discharge on the back end. So when it's been shown that when you do deploy intense primary care and you actually care for a patient on the front end, you're going to have fewer emergency department visits, fewer total hospitalizations, and much less expensive care, because the most costly care by far comes in hospital settings. One quick note from the report, Marcus, the average cost of handling 10 common primary care treatable conditions in a hospital emergency department was $2,000, according to a survey from United Health Group, over $1,800 more than it would have been in primary care settings. So like $200 care is costing in a primary care setting. That same exact care is costing $2,000 in a hospital setting, just because hospital costs and for services are astronomical. And that's just leading to this crazy inflation of healthcare costs overall.
Primary care focused strategies, you say, reduce the likelihood a patient will need those more expensive hospital care visits in the future. You lay out a very interesting example in Rhode Island, how things worked out when they tried to tackle this very problem. There's a really interesting study survey from Philips and iResearch Services from May of this year, locations for routine care delivery according to US healthcare leaders, what they are today, where they'll be in the future. Today, out of hospital procedural environments, ambulatory surgical centers, office-based labs are out in front, 56%, but that's going to fall significantly to 24%. The second place option here is going to surge into first place, ambulatory primary care centers, urgent care walk-in clinics. That goes from 43 to 74% from today to 2024. So that's going to take the number one role in terms of the primary location for routine care delivered. Then you've got long-term care rehabilitation facilities, nursing homes. That goes from 24 to 13%. So that drops. And then care in the home and care at pharmacies and retail locations, they both go up. Is there something from this changing in terms of the locations for routine care delivery that jumps out to you?
Well, really notable, Marcus, that healthcare leaders, 74% of them think that in the next 3 years, most routine care delivery is going to take place outside of the hospital. And the only way to bring costs down is to move care outside of the hospital and into these different settings, that this research found, whether that's, walk-in clinics or, even urgent care, primary care centers. And that's really the key to all of this, that more and more care is moving outside of the hospital. And 3 years from now, it will look a lot different than it does today.
Part of your report talks about fee-for-service reimbursements versus value-based care. So to explain fee-for-service reimbursements, you note insurers pay providers for every patient visit and service performed. It can result in redundant testing, and the payment model doesn't align with the goals of chronic care management. Value-based care, insurers pay providers based on the quality of outcomes and ability to lower costs. Holistic team-based approach emphasizes care coordination between a patient's providers and their incentives for chronic care management. So it's kind of, the value-based care reminds me of the world I came from. In the UK, we have the National Health Service, and they pay physicians more if they can prevent you from having to come back to see them for the same problem twice. So if you
Quite a concept, right?
Yes, kind of revolutionary. If a patient comes to you and you don't fix the problem, if you don't help them, they have to come back for the same problem within a certain period of time, then they don't make as much. If you're able to treat them and fix them and send them on their merry way without them needing to come back for the same thing, you get paid more. So what surprised me is that it seems like there's a shift to value-based care in this country, but how can you have that in a for-profit healthcare system? How's that going to fly?
Yeah, it's a really good question because traditionally providers in the US are paid on this fee-for-service basis. Each service, consultation, a flu shot rendered to patients, a service code is assigned, the provider gets reimbursed from the insurer based on that. So it really comes down to, how contracts with insurers are designed and how care is incentivized. So if the contracts are designed, like you just mentioned in the UK, where a provider will actually make more money in reimbursement from an insurer if they take care of the patient and if they keep them out of the hospital, if they do chronic care management, then providers realize, well, if I'm going to get paid more, well, I will do these things, right? It's all about incentives. Right now, those incentives aren't really there. The U.S. healthcare system has been trying to move to value-based care for a while. It's been really, really slow. But it's important to note that some of these primary care disruptors, a lot of them actually are, focusing on value-based care. They're focusing on Medicare Advantage population. Medicare Advantage is a value-based care program, other than it's separate from traditional Medicare. So if you focus on those patients and on value-based care arrangements, providers have the ability to kind of reel in some big payments. There was a note in their report where providers in certain Medicare Advantage payment arrangements can make up to like $15,000 per patient per year if, of course, they keep those costs down and keep patients out of the hospital. If not, there is a downside to them that they could be, not raking in all of that money, of course. In your typical fee-for-service payment arrangement, you're not going to make anywhere close to that, but then there's no downside as well because you're not on the hook if the patient gets sicker.
Right. Finally, Rajiv, you write in your reports about technology's heightened role in primary care disruption. Really quickly, could you give us the gold, silver, and bronze medal examples of technology that is being used and having a more prominent role in primary care disruption?
Yeah, I'd say there's some of these companies have, really innovative technology to help physicians and get them through their work days easier. And then some of them are for patients, of course. For the patients, the gold, I think, is kind of what we talked about. It's easy apps and same day appointments. And you can just do telehealth, right? Like at One Medical, if you're a member, you can just go right on their app and you can schedule the appointment. And you can do the telehealth appointment right from their app, and you can text the doctor, right from that app. That's not happening in your brick and mortar primary care physician practice. So that would be the gold. The next thing is there's, home-based care, more personalized care. So, can you deliver in-home primary care services at a rate that's, efficient and of high quality? So that's really interesting. Humana is one company. Think of them as an insurer, but they actually own primary care clinics as well. And they've invested money into this company called Heal, a digital health company called Heal, where they actually deliver in-home primary care to Humana members. And if you are one of these members that's eligible, you can just schedule that primary care service at home through your app, sort of like Uber. So that's really interesting as well. And then just one quick one on the provider side. Well, how can you make life easier for physicians by using technology? A lot of these companies have these internally developed EHRs where a lot of providers hate EHRs from the commercial EHR companies, but the ones that some of these companies have are internally developed. These internally developed EHRs are more specialized for primary care. They're built from within, and physicians have higher satisfaction rates with them compared to some of these other legacy EHR systems, which can be very clunky and cumbersome.
Yeah, the fascinating examples. The one that jumped out to me was Forward, personalized testing and scanning. So, a patient's first visit, Forward captures 500 biomarkers from a blood test, genetic screening, and in-clinic body scanners that designs helps to create a biometric baseline and then integrates the data into a patient's health profile. I thought was fascinating. So tons of examples in the report. The report is called Primary Care Disruptors, the Transformation of Primary Care is Upon Us. It just came out last week, written by our very own Rajiv Leventhal. That's what we've got time for the lead story, Rajiv. Time now for the post-game report, where we summarize the key takeaways. Rajiv, hit me with 2 takeaways, if you can, from today's show.
Yeah, the first one is that traditional providers will need to really, really ramp up their digital health capabilities because you have this disruptive cohort of new players that are doing so. Satisfaction scores from your traditional incumbent providers are so much lower compared to some of these innovative companies, and they're going to have better and more seamless technology experiences, be it through apps or portals or what have you. Otherwise, they're going to lose patients to these newer companies. And then I would say the second one is that, like we mentioned before, some of these companies are not going to last and stand apart from others. So the ones that will are going to, again, have to be really tech-focused, patient-friendly, and really design everything around what the consumer wants. Because the 2022 healthcare consumer just has different expectations for service and convenience than they've ever had before. Some of these younger millennials and Gen Z patients just don't care as much about that personal provider relationship. So you're going to have to meet them where they are and develop strategies that are tailored to personalization.
Right, that's all we've got time for today's episode. Rajiv, thank you so much for hanging out.
All right, thank you. I had fun. Thanks, Marcus.
Same. Thanks to Victoria. She edits the show. Thanks to everyone listening in. I won't see you tomorrow, but Jeremy Goldman will for the second episode of his brand new show, the Behind the Numbers Brand Anatomy, where he'll be speaking with Brian Rowley of Panasonic.